Welcome, everybody. To keep us on time, we've got a lot of great presenters today. We're going to go ahead and get started with just the short amount of business at the beginning that we usually do of the agenda, which I will pull up. You should have a copy in front of you. Just pretend that I sent you, or I printed off the right times on the agenda. It was like a multiple rendering. I think what you guys has it wrong. We'll pretend. There's like a half an hour gap in there, just ignore it. This is what we're rolling with today. I did forget to grab a sign-in, so we just have this basic sign-in. Obviously, there's not enough check boxes because this is just a quickie. So, name, email, especially if I don't have your email, make sure you write clearly because we want to make sure that we get you signed up for our weekly update, which is our e-newsletter that's sent out. For those of you that don't know me, I'm Melissa Moore. I do substance abuse prevention work out of the health department. Majority of my time is spent working with the AOD Partnership, which is our local substance abuse initiative. It is a local nonprofit as well, which makes it a little bit different than some of the other coalitions around the community. We don't do formal notes. Start signing on. We don't do formal notes because we do record all of our meetings and they do get posted onto our YouTube channel, so you can view the last meeting, which we focused around medication abuse. We had a presentation about a new report that was released, as well as some of the commonly abused prescription and over-the-counter medications. So if you haven't seen it, or if you want to get to know a little bit more about the latest trends, go ahead and jump on that YouTube channel there. Couple things, just another reminder that we did change our AOD meetings to quarterly, so every 3 months, to allow us to have a heartier conversation. So we have extended the time to 2 hours. As well as to be able to focus more around some of those specialized trainings and events. As many of you have already attended, looking around the room, a lot of familiar faces, we do spend a lot of time, and especially over the last few years, partnering with local funders to have very in-depth national level trainings. We are actually probably some of the only ones in the state that are this lucky to be able to have this. So I want to recognize Ascension St. Clair's. Patty's here in the room working with us to hold another part of the marijuana use series. Last year we had 4 sessions. This year we're probably going to have 2 full day sessions around that trend, which is extremely concerning anytime you turn on the news. And then also working with the area health education centers, or AHECs, around the central and northern region to continue the Overcoming Addiction Together workshop. Last year that was a 3-part series that we're going to do at least 1 day intensive around things like social determinants of health and how things that are impacting us impact addiction from that area. So that's kind of some exciting announcements. We are actually going to have our 10th annual Spotlight event. Some of you have been here from the beginning. Ron. So we're really excited to be able to bring that again to the community. Don't have a date set yet. Hopefully this Friday we're going to be getting some of those things finalized, and that information will go out. And another one of the big events that we're going to be continuing to do is the 3rd Recovery Summit. If you remember, 4 years ago, I believe it is now, we had our first Recovery Summit and brought concepts to the community like sober living, sober work sites, or recovery supportive work sites, recovery coaching, amongst others. And then we had a second one the year after that, and we kind of went on a year hiatus. So we're going to have our 3rd one this year. So again, looking at ways that we can support recovery. And as many of you know, it's important for us to support recovery as one of the critical things to prevent substance use, because substance use in the home is one of the indicators that may lead to future substance use as adults. So a lot of opportunities, a lot of things coming up. The meetings themselves, I don't have anything set for May, so this is a plug for people that are in the audience that may be interested in sharing some of the things that they're working on. Reach out to me. We can look to shape the program around some of the things that are going on in the community. So with that, I'm going to turn it over just for some brief updates from some of our partners. One quick one that just came to me here, something that will go out in the update, again, why it's so important that we have your email, is that there's a financial wellness conference, which again, financial status is one of those social indicators that could impact addiction and successful recovery. Plug. This will go out in the update. It is actually on Saturday, February 8th, here. So that information will go out in the update, so watch out for that. And could I have someone talk about the life report that was just released? Come on up so we can get you on the mics. Emily, did you need a mic up here?
No, I'm good.
Just checking. Now's a good time. You're welcome. I don't have a copy of the snapshot up there.
They're over there, yeah. So the 2019 to 2021 life report was just released, 2 Fridays ago? Yes, something like that. So if you didn't attend the event, it was awesome. And we are really happy that it was taped. So we're working on getting the link, and that will be up on the United Way website soon, right, Sarah? So if you haven't grabbed a copy, please do so. This is just the snapshot report. So we do the life report every 2 years, and we look at the community data to inform us where we have opportunities to improve our community. The steering committee, along with an advisory group, looks through the data and puts out some calls to action. So this year we have 7 calls to action, most of them kind of surrounding around the social determinants of health. The new one that we called out this year that we're pretty excited about is diversity, inclusion, and belonging. And our panelists did an awesome job talking about what that means and what that looks like and feels like in Marathon County. So we're really excited to put that link up so that you guys can look at it further. The other exciting thing is that we have a new data platform for the life report. So all of the data is live. So it's not a static report anymore. You can go to marathoncountypulse.org, and Melissa has that up on the screen, and you can really dive into the data. And as we get new data, the links are updated, so it's in real time, which is really exciting. So if you want to look at the sources, and if you're writing for grants or putting things together in support of some of the community projects, this is a great way to do it. Anything else? Sam, do you want to include anything?
Has anybody here, how many people have heard of Marathon County Pulse? Can I see raise hands? Good. A lot of you. Those of you that haven't, like was already mentioned, if you go to the website, marathoncountypulse.org, you can search for any keyword in here, and it'll give you all the data that's available that has multiple years of data. So it's not like we did one survey and it gets put up here. It has to be something that can show some trends. So it is something that's great for a lot of different things, and there's dashboards that are already created. So things that are linked, again, like Tara said, to the life report, you could actually just go to it and click on it, and then it'll give you whatever data is available related to that. Yeah. So check it out. Shameless plug.
Yeah, grab a copy.
And you may notice a couple differences between the online and printed, but the information itself is all the same. Okay, Christine. Would you like to come up and talk about some of the changes within Wausau Comprehensive Treatment Center?
Sure.
You can introduce yourself.
Okay, I'm Christine Zelahusky. I'm the clinic director at Wausau Comprehensive Treatment Center. We do outpatient drug addictions treatment through medication assistance. And we just started a transitions program where we are able to prescribe Suboxone to more stable patients, so that they can have more of a, they don't have to come to the clinic quite as often. So they still have to come, they still have to see the doctor monthly, they still have to meet with a nurse monthly, they still have to meet with a counselor monthly, but they can work their way up to a month of prescription. And the nice thing about that is, especially if you're a more stable patient, you're presented a lot less with the addictive behaviors of people who are struggling a little bit more and have less of a temptation to relapse, especially if you're in a stable home environment, which is required to be in the program. Just a quick little thing too, we are looking for a nurse practitioner or physician's assistant, very part-time. So if you know of anybody, send them my way, please. We are looking to grow our availability of healthcare professionals as well, and looking to try to have somebody on a daily basis during the week available for admissions. So,
thank you. I have to put in a plug for Wausau Comprehensive Treatment Center. They are the clinic that's located in Washington Square downtown. A lot of people call them the meth clinic or methadone clinic. Please stop. They're the Wausau Comprehensive Treatment Center. I'm just saying, please, please, them. But they have a lot of great opportunities there and a lot of great resources. And if you have questions about that kind of treatment, please reach out to Christine and her staff because they're more than willing to help you out. You could do tours there, you could set up things like that. So, knowledge is power. Allison, can I have you come on up? One that is not on the agenda is my colleague, Allison, from the health department. She's going to talk about children and youth with special health care needs, which is a regional effort. A little bit about their programs, because it definitely is timely within the confines of today.
Yeah. So thanks for having me. The Regional Center for Children and Youth with Special Health Care Needs is actually housed within the Marathon County Health Department, which is a great partner for us. And I just wanted to put in a plug for one of our resources and one of our services due to the topic today. About 50% of the calls that we receive from families are related to mental health, behavioral health, or those things related to autism. Our regional centers in the state originally started out as more serving other related health care needs. So we've really tried to boost our resources related to those areas. And hopefully by the end of this week, I don't have a flyer for it, but the health department is hosting the statewide every year. The Wasteman Center and other statewide partners have a community of practice in the late winter, early spring around autism and mental health. So on March 10th, the health department will be hosting that, and we'll get the flyer out for you as soon as it's ready.
Okay. Any questions for Allison? Okay, a couple other partner updates. Rise Up is going to be having a documentary release. The project that was around the WOW mural, if you've seen some of the news on that, on this Thursday. So that information, the announcements are usually on the back of your reverse of your agenda, so you'll have a lot of these. Another one that may be a little harder to read is a youth development training. It's something that came to me from other areas, another partner in the state that sounded interesting. So for having a youth focus today, I thought it was important to share this as well. Unfortunately, it looks like we missed the early bird as of today, but hopefully you saw this in the update last week. But these folks are nationally known speakers around this issue. And that's that. Any other partner updates that we missed? Nope. Okay. Well, we're going to move on. So I'm just going to kind of tee up the conversation today and kind of set the stage. I won't talk long because I know we've got some great speakers here that I want to make sure we have enough time. So called this what we did because I struggled to find a name because mental health needs of Marathon County youth wasn't that sexy, right? Trying to find something that kind of gives that little precursor, that little tease. So I'm not really crazy about it, but the topic here is something that I am crazy about. It's something that I think that we need to have more conversation around because when we talk about substance use and addiction, they are intertwined. Nationally, we look at the data, about 1 in 4 individuals with mental illness, some sort of diagnosis of mental illness, develop substance use disorder. On the traverse, about 50% of those with substance abuse disorders develop some sort of mental illness. Think about a person that maybe has smoked marijuana for a very long time and they stop using. Or somebody that smoked cigarettes and stopped using. That drug kind of rewires the brain where things like anxiety and depression can really be linked to it. Or heavy use of marijuana, for example, is linked to onset of schizophrenia as well in some studies. So, I think that there is an importance for us to make sure that we do talk about these things together. And that's why, today we're talking about youth mental health, but you got to keep in mind this is all tied back to us trying to prevent mental or substance use disorders as well. Because our brain develops until we're 25. Some of the critical parts of our brain that develop last is the part that says good idea, bad idea. Our prefrontal cortex is the part that develops into our early 20s. So, when we say, kids, why are you doing what you do? And I say kids broadly. I still call people kids that are older than me. But when we look at it, some of the times you can't decide what's a good idea, bad idea until you go through that experience. And really our goal is to try to reduce that 30-day use rates. That's one of the things that we look at. And when you kind of lay across the onset of major mental illness, and again, some of this stuff comes from different resources, so take it as a range. it is linked back to our teen years. When I say teen years, I'm saying anywhere from late elementary school through high school and into college. This is something that is significant. And the earlier that people use, for example, alcohol, if you use it before the age of 15, you're six times more likely to develop alcohol use disorder or be tending to abuse or binge drink as an adult. So they are definitely linked. So we want to delay this as often as we can so our brains can completely heal. And there's a lot of things that lead to addiction. Things like genetic disposition. About 40 to 60% of individuals with addictions in their family have a higher likelihood of developing addictions as adults. The environment in which we live, what's available to us. People don't like the term gateway drugs, but I look at it as what's available in the home. If you have heavy marijuana use in the home, your likelihood is higher to start with marijuana. If you have a lot of pills available in the home, you have a higher likelihood of starting with pills. Do you go to other things automatically? I'm not saying that. But when we rewire our brain, the likelihood is increased. One of the things that I didn't cover on the last slide was the early traumatic exposure. And we've done a lot in our community to talk about ACEs, or adverse childhood experiences. The more ACEs we have, the higher likelihood you are to have issues such as addiction. So the ACEs, some of the examples are down in I should know that, doesn't work. The lower right-hand corner. And as you can see, some of those things link back to a whole host of health and social related disorders and maladaptions. Some of those effects of early teen use. And again, linking back to mental illness, we already talked a little bit about that. NAMI's got some great resources online. Bernie is going to be here from NAMI at the end of our presentation today. But when you look at, about 3/4 of individuals that are diagnosed with a mental illness, it happens before they're 24 or before their brain fully develops. That's why we're talking about this. That is a huge point in data, about half of those before the age of 14. So, the effects are wide. There's some of the negative effects here, and that's why I'm excited to have some of our partners here to talk about what's happening in the community to support our youth and to grow our healthy youth, both in minds and bodies. So the 2019 middle school and high school data has been released. It is part of the upload for the calendar for this meeting. You can see here, I just kind of pulled out some of the data, and I believe that some of the folks that are around the room have used this data to help illustrate the need in our community. One just kind of asterisk, when you go on Marathon County Pulse, you'll see trend data, because we've started doing aggregate data for the county since 2015. One thing to note is that between 2017 and 2019, the state changed how they aggregated the data. So don't compare the 2 years together for trends. Look at them as points in time. Because when the way that they did it, it may look like we've decreased in some things or increased in some things, and that maybe isn't necessarily the case. So I guess look at what we got right here. When you compare middle school to high school data, these are just some of the data points that I thought were important, including our mental health data, our substance use data, and then that connectiveness data, which again is part of our presentation here today and the folks that we've invited to be in the room. So this presentation will be uploaded, so you'll have this as well. Sorry, I don't have it in front of you. But there is some great resources on the link at the bottom, which is always something that we like to share. But when you look at things like anxiety and depression, the self-harm, considering suicide, having a suicide plan, I just want you to, let's start with that chunk. So absorb the middle school data. Now this is the high school data. You'll see, not terribly significant changes in the data, but there is some changes. The first data point actually goes up 2 points, or goes down 2 points. The rate of depression goes up 3%. Self-harm goes up 3%. Having a plan goes up 2%. And I don't like to look at kids as numbers myself. It's too many. This data is too much. When we look at our substance use data, that's where you're going to see some pretty significant changes. Substance use from middle school data is 6th grade up to the point where our 9th grade, 10th grade, and some 11th graders are being surveyed, is pretty significant changes. So again, middle school, to high school, you can see some significant changes in that. Things like vaping going up over 10%, other tobacco use going up almost 10%, alcohol use going up 20%, and on and on. So you can kind of see some of those pieces. You can also see some of those more heavier, scarier illicit drugs such as heroin and meth. We didn't even ask those questions. The only question we asked was cocaine on our youth risk behavior survey until last year. Because this survey was created on a national level, it's evidence-based, it's all good data, make sure you use it. They made it in the 90s, and what drug was popular in the 90s? Cocaine. It's the only drug they asked about. Everything else was lumped together. I'm like, no, please split that out. The last one is that connective piece, feeling emotional support most of the time. About 42% of middle schoolers, 83% saying they have an adult that they feel cares about them or they can lean on. But when you look at the high school, look at the support. It's cut almost in half for feeling like they have the emotional support they need. That is a significant change as we get older. And developmentally, how that can affect things. But one thing that's good is that we do have caring adults in this community, and that really hasn't changed. And I see a lot of good head nods here. So what I'm going to do, I'm just going to kind of tee this up with our Marathon County Teen was a initiative that came out of our 2017 Youth Risk Behavior Survey. And working with Laura Hunt, a local cinematographer, she put together a number of chapters, or you can view it in its entirety at healthymarathoncounty.org. But this is the one that's specific to mental health and stress, and I did not check the volume, so I hope we don't get blasted.
I know there's a lot of anxiety because I have anxiety really bad, and I know other people do too. Depression, yeah.
Unfortunately, right now the trend is being depressed. You'll find a lot of people posting, sometimes descriptive, depressing posts on Facebook about wanting to kill themselves, or math class was so bad today, kill myself. It kind of made me feel bad because I'm actually depressed. I have an actual problem. When you're in a sad state, one little pick will feel like a whole wound.
I used to cut. It was only for a short while, and that's when I was extremely stressful, when I was going back and forth between households.
Sport in school can be a lot, and then when you add a family issue on top of that, that's like the trifecta right there, or maybe there's money issues at home.
A lot of us, what we come here to school is we put on a happy face, but what's going on at home is a whole nother can of worms, and people don't really see that.
All the stuff with my grandma and my uncle, and then on school, just everything was on top of me, like it's all on my shoulders.
I don't know, for a while it was really hard. Like right now I'm on some sort of depression medicine. Sometimes I would just give up completely. Like I just kind of stopped trying. All my grades started to drop. I was like, there's no use, because like I'm failing this and I keep trying to get out of it, and then something else will get tacked onto it, and I won't be able to like finish one thing on time. It's like a snowball effect. It starts small and rolls into a huge problem.
It's just the pressure. It's expectations of people. School, your future career, judgment from others. I mean, eventually you just get to the point where you stop caring.
I don't think they understand the pressure of expectation and how much is healthy and how much is not.
I think they don't understand that we have a lot going on, not just like with school or with like homework or jobs or anything, but I think personally we're all still trying to find ourselves. Oh, like you're fine. You're just freaking out. It's just your hormones. And like even if it is, I think that they should still be understanding and realize that it's how we feel.
I'm kind of socially anxious, so that kind of puts like a damper on my ability to kind of fit in with some kids. It just kind of creates sort of a hard environment to be in, like all day, every day.
I've never really been confident in myself. I don't know why. I focus on my looks and my grades too.
What about you? Do you have anyone in your life?
Not really.
So how do you handle it all?
Just keep it to myself.
And that never gets too much for you?
Not yet.
So do you feel alone?
Yeah, a little bit. Just have to deal with it.
But you wouldn't like talk to your parents about that kind of thing?
Not really. No, they've been through so much. I wouldn't want to worry them.
Is that how you feel?
Yeah.
I think it should be talked about more because like we put so much emphasis on like drugs and alcohol and sex and all that, but they don't put emphasis on things like depression and your happiness and how to live a happy life. And I feel like that's so much more important because that can, if you fix that problem, it can lead to fixing a lot of the other problems. And when kids are happier with themselves, they make better decisions.
So a number of community partners came together to make that video, so again, use it. I want to take this moment to thank everybody that we had to be part of today, and I'm going to invite Kaylee up. You may recognize her. She was in the video. Kaylee is a huge advocate for youth and all that is, growing up in Marathon County, so I'm just going to welcome.
Yeah, absolutely. Hi, everyone. My name is Kayla McCauley. I'm a 2018 graduate of Wausau West. I work as a behavioral health technician at North Central. I work in the psych hospital, and I attend NTC for nursing. As you saw, I was featured in the video. I really encourage you guys to check out the video in its entirety because there's a lot of really good information and a lot of really insightful youth who have awesome things to say outside of just me. So when this documentary was created, Laura Hunt had approached myself and several other students about sharing the video and then also including a panel discussion with youth from the community, which is really awesome just because Laura could have just taken the video and been like, hey, this is what the youth are saying, instead of actually having us come and be present and share our experiences being the youth in the community. And so through that, we had about 5 or 6 teens who would regularly come and present their ideas on the panel discussions. And it was on things relating to class, race and ethnicity, mental wellness, and through that kind of came what we call now Marathon County Youth Council. And so with that organization that we've created, we have done some things in the community, including this past summer. My friend Ethan, who's also on the Youth Council, we came up with what we called the elephant we can't see. So we were kind of reflecting on the past couple of years of having been part of these panel discussions, and we realized that we've never really put on an event that was entirely our own. So this ended up being a pretty big undertaking, but it had a really awesome outcome. We created an open mic night for youth in the community to come and share some things about mental wellness, eating disorders, depression, things that we all want to talk about, but we just don't really have the opportunity to do so, especially not in a space that's very youth-centered and without adult intervention. And so it was entirely youth-hosted. I would have been happy if we had maybe like 20 people come. We had 120 people come. And when we opened up the mic, I mean, we had to cut it off. Like, people just kept coming. And so some of the topics that emerged were super sensitive and super personal, and they were about people I went to school with, and I didn't know that they had an eating disorder, that they had depression, that their parents were using drugs. Another thing that surfaced was the recent suicide that happened in the summer, and a whole bunch of people who are going to high school right now are saying that we're not talking about this. It's like this person who was just here with us, they're not now, and nobody's acknowledging it. And so this was one of the first time that youth really had that opportunity to just say what was on their hearts and do it in a way that was creative and also safe. So the good news is, even though it was a lot of work to make it happen, Youth Council is definitely looking at doing that again, either late spring or the summer. And Ethan and I will plan it out, and hopefully we have a lot of connections now after having been successful this first time around of people who are willing to help us. I know that the Healthy Marathon County Board, they had given us funds to make it happen. And you know, like Melissa said, there are a lot of adults in this community who, if we have ideas, they're like, yeah, we're on board. And we're like, wait, we haven't even explained what it is yet. So I think that's my little brief summary on today. But if you have questions, I would love to connect with you on a more personal basis and answer any questions or hear input. And definitely, if you know youth who would like to be involved, send them my way. We're always looking for new collaborators and new people with ideas. So thanks so much for your time. Thanks for having me today, and I appreciate it a lot.
Thank you. I think what I'm going to do is I'll put together like the speakers from today, like all the email contacts, so then people can reach back out in case it's not part of the presentations. So with that, I'm going to have Hilary and Lexi come up and talk about their project that they're doing through the medical college. And I might be able to figure out what I'm doing here. Sorry. I have too many windows open. Present. I hope it doesn't move on you automatically. So you can use the arrows or the clicker. Preference?
All right. Doesn't matter to me.
Well, use whatever you want. I'm not going far.
Okay, that's good. Hello, everybody. My name is Hilary Pole, and I'm Lexi. And we're both medical students at the Medical College of Wisconsin, Central Wisconsin campus here in Wausau. So what we're going to talk about today is what we've been doing in the DC Everest district in regard to trying to help with some of this stuff we've been talking about today. So as you can see on the first slide, this is a t-shirt from our event last year that we held. Okay, so how we got started into all of this was actually the YRBS data. So Brooke Davis is a counselor at the DC Everest Junior High, and she was looking at this data back in 2015 and said, 28% of students are saying that their mental health is not good. And she said, we're not seeing that percent of students getting help in the schools. They're not seeking out counseling. They're not talking to teachers. So she said, what am I going to do to try to help with this? So she came to our medical school and kind of presented this data to us, and she showed us how she had found under the Department of Public Instruction that there was an approved screening tool that you could use in schools to try to identify these students that might need help that nobody knows about it. So then she kind of asked if any medical students would be willing to help her with this, and that's kind of when I came on board a few years ago. So what we did is we sent a consent form to all of the parents of the junior high students. And then the ones that were returned to us at the school, we then pulled those students out of their homerooms on a random basis, so no one would know who had turned in consent and who didn't. And then we read a script to them as medical students on why they were there, what this was trying to do, what information was confidential from their parents and us, what information we would need to share with their parents. So one of the big things was letting them know that if they reported any drug or alcohol use, that would not be shared with their parents. And then we got the students a sense. Any student who talked about having a plan or intent to commit suicide was immediately flagged, and those students were seen that same day that they took the screener. So because of just that, it caused us to only be able to screen a certain amount of students per day because we needed to have the staff to see any students that might be flagged that day. The parents were contacted for any students that did indicate any suicidal ideation in the last year. And then we referred to outside agencies as necessary for those students. We also calculated total gain scores for those students and had IRB protocol for this. So this is kind of an example of what the screener would look like in its entirety, but this is just one section of it so that you can see how they were rating themselves on these questions. So here you see the internalizing disorder portion of the screener, and they rate how often they think these things that are written out here. So this is the red flag question that we had. So any student who looked at the question E that says thinking about ending your life or committing suicide, if they indicated anything other than a 0, which is never, they were seen that day. So this is kind of the data we got from our first implementation of the screener. So 877 students in the DC Everest Junior High had consent forms sent out to their parents with information on what we were doing and why. And the parents of the students had the option of whether they were going to turn that consent form in or not. And as you can see, only 134 parents chose to do so. And then out of those 134 students, there were just 4 students that declined to take the screener when asked and told about it. So we ended up with 123 completed screeners, and just out of those 123 students, there were 20 students flagged for suicidal thoughts. These are kind of the subscores that we calculated with the GAIN screener, and as you can see, the total score is where I, as a medical student, felt the most concern for the district, because about 48% of students had a total GAIN screener score that indicated they were at high risk. And in that school of, I think it was 877 students, there were at the time just 2 counselors to handle those 48% of students who were deemed high risk on the screener. We also looked into GPA and disciplinary actions for the students that took the screener, because we wanted to know, are there other signs that we can look for that people just think, oh, well, if a student's struggling in school, that might indicate a mental health issue. Or, oh, there's more disciplinary actions for this student, maybe they have a mental health challenge. But as you can see with the data, that trend doesn't seem to hold true. So the students that we're seeing struggling more often in our data with mental health disorders, there aren't obvious signs, which kind of shows why we need to be screening students in schools. So this is just kind of a conclusion slide about what I sort of took from this data and what I did with it. So out of the students that we screened, the amount who had suicidal ideation in the last year was 16.2%. In a school of around 900 students, to give you kind of an understanding of what this percentage means, that's roughly 144 students if you were to extrapolate that to the school itself. We did not get the ability to screen all of the students in the school. However, I have to kind of err on the side of caution that those students who weren't given consent by their parents to take the screener, it doesn't mean they're not also at the same rate. And as we saw from Melissa earlier, this is about what they're seeing in their data, as well as that 14%, 16% for suicidal ideation. Again, that's the same percent of students who were deemed high risk by the screener. And one of the telling signs is only 15% of the school parents gave consent for their child to take the screener. I've been at the school a lot talking about these things with parents, and there still exists a lot of stigma. Parents are afraid to have their kid even take the screener because they don't really want to, I don't know all the reasons, but often when they were with their student in front of me, a very frequent conversation is the parent would look at their student, put them on the spot, and say, do you need to take this mental health screener? And the kid would just kind of look down and say, oh, no, I don't need it. And then the parent would walk by. To me, that's kind of unfortunate because I don't think many students put on the spot in a public setting in front of people they don't know are going to say, oh yeah, Mom, I need this screener, or yeah, Dad, I need this screener. So something with this I would like to work on in the future in the school district. Another thing from a medical side, since I am a medical student, is I think about my future career path and what am I going to be able to do to help with this in a clinical setting? And unfortunately, the answer is not as much as I would like to. So when I look at different studies that have been done on how many adolescents seek primary care health care, only about a third, as you can see in this paper, have had, or a third of adolescents weren't even getting any primary health care. So I would be missing all of those proportion of students in an exam room when I'm a physician one day. So that kind of showed me the importance as a medical student in being involved in community outreach and being involved in the schools and not just sticking in the hospital, sticking in the clinic. That isn't going to do enough for this issue. So that's when we came to doing this Kind Minds event, and then I'm going to have Lexi. She kind of came on board at this point when I decided I was going to do more, because I thought, if we're not getting consents and we're not finding these students who need help, what else can we do? And that is when I decided, hey, let's do this mental health day where we bring all the students. We started with just 9th grade students is what we're doing, and give them activities and sessions that are designed to try to educate them, since I had also seen the Marathon County Teen video where a lot of the students were saying, hey, we're getting all this information on drugs and alcohol, but we're not getting information on depression and anxiety and things like that. And I thought, well, this would be a great way to try to educate them on these topics from so many people we have in the community to utilize.
Yeah, so this Kind Minds event, as Hilary was saying, was made to just kind of start this conversation about mental health and overall wellness. Obviously, the kids are saying they're not getting enough of this discussion in the school, in the classrooms, so we figured, why not have a day to talk about it. Our first day was last March. And this is kind of just the setup of it. It was at Dales Weston Lands. We had some funding and they helped us out. We had 5 different sessions. Students went through the day. The sessions there was core sessions and wellness topics. So the core sessions were meant to be different topics, how to lower stigma, talking about testing anxiety, social media, understanding and addressing teen dating violence. So just kind of the big topics. With only having 5 sessions, each student getting 5 sessions, they got about 2 to 3 of the core sessions, and then they also got wellness activities. So yoga, horticulture, pet therapy, art therapy, different things that they can do in their life outside of school or even in school on just how to improve their overall well-being. So they all got, unfortunately they didn't all get to do everything, so that was kind of a bummer, but they did get a couple. We had a bunch of volunteers that helped us out that day. This is just a picture of a few of them, but we've had a lot of help from our community on putting on this day, which we would not have been able to do without them. So at the end of the day, we had a screener just kind of to see what the students were thinking about, how the day went, what they thought could do better. And we were pleased to see that 80% of students thought that the day gave them a better understanding of their mental well-being and ways to improve it. And also 83% stated that they obtained information about resources that would be useful if they ever needed it. So overall, students were saying it was a beneficial day. Some of the more highly rated topics that the students liked were about testing performance anxiety, substance abuse, and then they also liked yoga and pet therapy. So those are topics we made sure that we brought back, and we brought back some new ones. Comments, they wanted smaller groups. Unfortunately, with what we had, Dales Weston, we only had so many rooms, so there was a lot of students in each room. And then they also wanted shorter sessions. We had about 45 minutes, so with those comments and the outcomes, we've made some improvements, we think, for the next one. We have a second day coming up in April, the 22nd. So we shorten the sessions. We're doing it at the DC Everest High School, so we have a bunch of different rooms. I think the max students per class is going to be about 30, so it's a lot more individualized. Smaller sessions. We're doing a new t-shirt design. The kids got to help do the t-shirt design. We're also doing something new, and we're starting out the day with a speaker from Rise Up. That's going to Rise Together. Sorry, Rise Together.
A lot of rises in
There's a lot of
community.
rises. So Rise Together is doing they're going to do a speaker at the beginning of the day, just kind of bring us all together, get us on the same page, kind of remind us why we're there. And then this is just our plan for the different topics we're going to be hitting. We haven't finished it completely, but as you can see, some of the new ones is we got Rising Sun, which is with a karate or
I think it's something like that, or taekwondo.
Yeah,
or
something like that. We have the kitchen available, so we're going to do kind of a cooking thing and gym activities. So we're with the new space at the high school. We have more ability to do different sessions.
Before you get to that, so with the sessions, some of the other feedback we got was specifically from the male students. I think we had an entire team that we might have taken for granted as our entire team working on the mental wellness day. We're all women. So we had some feedback on the surveys from our male students saying, hey, I want more active sessions. I want more things geared towards my interests. So that's where we added more of these gym activities and active activities with Rising Sun to try to show that, hey, we care about you just as much. We want you to feel like you're getting a lot out of this day as well. And then one thing that we've been trying to do with proposing these sessions is reaching out to different organizations that already exist in the community, because what I've noticed the past few years working on mental health with adolescents is we have so many pockets of amazing organizations and groups, but we rarely have them all coming together for a shared purpose on the same day with the same population of students. So that was sort of how I thought about this and what I've been trying to do the last couple of years. Yeah. Sounds good. Sure. So future directions, things we want to do to try to wrap things up here is I would like to work on meeting with school boards and talking to the school about not utilizing an active consent process, as I discussed earlier with the parent consents. I think a passive consent would work much better so that students who are not talking to their parents, as we saw in the Marathon County teen video, they're not necessarily talking to their parents when they have these struggles. So therefore their parents are not turning in a consent form and we're missing those students. So I would like to see us evolve towards more of a passive consent process for screening for mental health. There are some challenges with this on why the school maybe hasn't done it this way is we look at the junior high that is 8th and 9th grade. That's about 900 students, and if we had a passive consent process and all of a sudden we screen all the students on the same day, that would be an overwhelming situation that this community does not have the ability to help that quantity of students all at the same time. So if we had those 144 students in the same day saying, hey, I'm thinking about ending my life, we don't have enough crisis centers and people in this community at this time to try to tackle that all at once. So I think that was sort of the hesitation on the school part to not be screening too many students at the same time. Another thing we'd like to do, and I talked about the second bullet point already, since the implementation a couple years ago with the screener, it has now been also started to be used at the middle school level as well. And I would like to see that also happen at the high school level in the future, and even start to present this information to other school districts. I've had a number of people, even students personally, find me and reach out to me and say, hey, I want this to happen at my school too, and it's not. What can I do? And unfortunately, right now where I am at, as a medical student, I just don't have the finances or the time to be able to say, oh, I'm going to start tackling this in all of the districts of this community, which I wish I could. So that will be something that I look forward to trying to create some type of foundation, something in the future where I would have the resources and manpower to do more. And then I think that was it with this, right? Yep. So does anyone have any questions on what we're doing?
Do you want to just refresh what the grades are? Because some people are familiar with middle school and high school.
Yeah, so DC Everest is a little bit different. Middle school, I think, is 6th and 7th. Junior high is 8th and 9th, which is a little different for most of us, I think. Most of us grew up in a school where 9th graders were at the high school. So that is a bit of a unique thing with the DC Everest Junior High and how their district runs. So one of the advantages that I see of having the wellness event take place at the high school this year is that we will be having, so the Kind Minds event, I'm not sure if I clarified this as clearly as I could have, it's for 9th graders. So because of all the things we're doing, we can't do 900 students in one day, it would just be chaos. So we did the Kind Minds event for 9th graders, and this year it will take place at the high school where they are about to transition to the following year. So because it takes place in April, it's a great opportunity for them to see the school they're about to be at come late August, early September, make connections with faculty at the school. I would like to eventually have a mentorship or peer-to-peer program via this event where we get junior students to kind of follow along with each of the groups of 9th graders so that they would already know a peer support person when they start school the following year. So that's another thing. I have all these ideas that I'm working on to slowly get this where I would like it to be.
Any other questions? Currently, go ahead.
Is there a sign up for assisting with the event in April, or?
Absolutely. If anyone is interested in volunteering or has an idea where you are thinking to yourself right now, hey, I think it'd be really great to do a presentation on A, reach out to me or Lexi. I'm sure we can get everyone here our contact information. Everything we present gets approved through the school first, as far as topics and presentations and things like that. But we are absolutely open to anyone reaching out and saying, I'd like to be just a volunteer to help shuffle students around, or I have a dog that I could bring who's therapy certified because that's one of our sessions, or anything like that. We would be happy to take any volunteers.
Any other questions? Okay, thank you, ladies. If I could have Lee and Hannah come up and talk about the school-based counseling consortium.
So I want to know if I can be a participant in Kind Mind Today, because that dog therapy is fantastic. So hello everyone, I'm Hannah Schumer and I am a health educator at the health department along with Melissa.
I'm Lee Shipway. I'm the Executive Director at Peaceful Social Counseling and the creator of the Marathon County School-Based Counseling Consortium.
Yes, you are. All right, so a raise of hands in the room today. How many of you know that students have access to see a therapist at school?
Oh, excellent.
Fantastic, because it's true. And we're going to just talk about how we got here, starting from the beginning. So in 2015, Melissa had talked about our youth risk behavior survey. So that became an aggregate county thing in 2015. We had 1/5 of our students in high school say that they're depressed, and 12 of them were reporting that they considered suicide. Now, first report of its kind came out in 2015. It put the numbers to what the kids' mental health status was and what they were saying, and what the schools were seeing every day and clinics were seeing after hours.
Right. So at the same time, I think it was the fall of 2014, when Brooke Davis, who's now the guidance counselor at DC Everest, was the guidance counselor at Edgar School, called me up and said, hey, we're seeing a lot of kids who really have some mental health needs. Is there any way that you could maybe provide counseling for those kids on site at the school? I so happened to have a therapist on staff who lived in Edgar, and I went to her and said, hey, how would you like to spend a week at the school instead of driving all the way into Wausau and providing therapy at the clinic here? And she jumped on that opportunity. So in I think it was the second semester of 2015, I could be wrong, I don't always chronologically document stuff, but I think it was January of 2015 when she then started providing services. As a clinic, you have to get a branch office with the state of Wisconsin, and so we got that licensure under DHS 35, that's the rules and regulations for outpatient psychotherapy clinics, and that was approved, and so then we started providing services. Then other schools started calling me because word of mouth gets out. Stratford, all over the place, and it was like, we can't possibly do all of this. And so then I think it was December of 2016 that I sent a letter to every clinic with the help of the United Way. We looked through the actual yellow pages, void pages, the 211 guide, and internet search to find any type of clinic in Marathon County as well as some in Wood County because of the western part of Marathon County. I just said, hey, this is what we're trying to do. We invited school personnel, and I think the first meeting was December of 2016. Then we started meeting in 2017 very regularly to get the consortium up and running.
And at the same time, I was hired on to do work in mental health in Marathon County. Pretty vague, but it seemed like a good fit for myself from the health department perspective.
So we met monthly from January through August, and then in the fall of 2017, we actually started providing counseling to kids in schools. At that point, we had 10 clinics on board, and it was a combination of nonprofit clinics and for-profit clinics. And we had 11 Marathon County public school districts that were represented. So we had school personnel as well on the consortium. 3 community organizations also worked together, and we discussed next steps and decided how we would do this. It was a lot of work, I'll be honest, in a short amount of time, but we were really happy that we just got it up and going. It's like, let's just do it, and we'll kind of worry about some of the details later. That's kind of how I roll. A lot of other people probably would have preferred to have this planning for 2 years and then we do it, and I kept thinking that's 2 more years where kids are not going to get any services. So we kind of went with it, and Hannah was a great, great addition and was able to do a lot of that groundwork for us. So the model we set up was based kind of on one from Nina area, and it was a 3-legged stool is how we talk about it. One is providing direct service to the students. Second one is providing services to the teachers in terms of educating them about mental health issues. The third was to try, and we're still kind of working on this, to do school-wide education for kids as well as parents about mental health. We really want to reduce the stigma surrounding mental health and substance abuse services so that it's more normalized, that everyone sees that it's a normal thing, that people have some of these issues. Just like you go to the dentist when you have a toothache, you go to the doctor when you have a broken leg, and you go see a mental health therapist when you have some kind of psychological issue that is causing you distress. So that's kind of the 3 parts that we looked at. Okay, am I missing something? Oh, and the other part that was really nice for parents, especially if you think about the western part of the county, those parents would have to take at least a half a day off of work to transport their child either to Wausau or Marshfield, and then you sit there in the waiting room while your child is in therapy for an hour, or you're maybe in family therapy with that child for that hour, and then driving back. And so it just was a lot of barriers to that. And so by having it on site, it helped reduce that for parents, as well as then you're not taking a kid out of school a half a day a week as well. They're going to miss 1 class. And so we worked really hard at this point, all the therapists at all the different schools, to try and take kids out of their resource centers or lunch or something where they're not going to be missing math class every week or English class or whatever.
Yep, so fast forward to today, so we did all that work, right? We are midway through our 3rd year, our 3rd school year, providing on-site mental health counseling. Now, there's 57 public schools in our county, and we have covered every single one of them. Every single school.
Some, it's only a half a day a week, but some are a day, some are 2 days.
Some are 5.
Some are 5 days.
Yep.
So it depends. What we did at the very beginning, Jen Smith from Bridge Community Clinic and I were the co-chairs the first 2 years. And we got a big marker board at my office, and we went through every single school, every clinic who we had met with to decide which schools they could provide service for. And I have to tell you, this is nothing short of magnanimous, that you get for-profits and nonprofits working together, number one. And every single one of those clinics said, you put me where you need me. Everyone was so wonderful and joined together. It makes me emotional again thinking about it. It really, really does, because there's so many kids that need that help, and I just love it when this community comes together and does what needs to be done in order for those people to get that help. And so that's what makes it. She started it all. So one of the barriers we've come across is that somehow the word got out that, oh, these sessions are free. I'm like, no, they're not free. So if you hear anybody talk about that, unfortunately, we're not able to do that for free. But what we do is, just like if you saw a kid in a clinic, you would be accessing their health insurance, or if it's medical assistance, if it's public health insurance. Or we do a sliding fee scale for the agencies that are nonprofits. For the for-profits, they do a reduced fee. So there is a cost to this. It's not free, but it's still a really nice resource that at least they have that right on site. We also recently submitted a proposal to the United Way. They just had their 3-year funding cycle come out for 2020, and we were awarded $25,000 for each of those 3 years. And so we're going to be using that for students that are not insured, or for students that are underinsured, like parents that have low income but a very high deductible and can't afford that. And so the steering committee is working on a mechanism to make sure that that is distributed in an equitable and fair way. So at the end of the 2018-19 school year, we saw 500 students. The first year, it was about 213 students, so we have doubled the number of students that have had access to services in those 3 years.
Right, and about half of those students had never seen a therapist before this one, so we're accessing the kids that need the services, right? So a little bit on the data side, we had, of the 4th through 12th graders, we surveyed them a little bit differently than the younger kiddos, just for questioning purposes and things like that. And what the 4th through 12th graders were saying is that 75% of them reported making progress on their goals. So therapy works, it's working in the schools. For students in K through 3rd grade, about 9 out of 10 of them said that they would go back to their counselor if they needed similar help, which is awesome. So again, the on-site counseling is working, helps the parents with the access. And then we also asked them what they liked most about therapy, and I have a couple quotes for you. Yeah. The major theme that we saw was that they liked having somebody to talk to without judgment and get some advice that they weren't always getting from their peers or their family. And so some of the quotes were, a high schooler said, "It gives me hope on finding myself. I feel much better than those years in junior high. I felt comfortable sharing and talking about what I needed help with." Third is, I always knew someone was there to listen and try to understand me. And then my counselor lifted my spirits about living and me being a good person. She acknowledged me. That's a lot. That's a lot. And from the kids' mouths, it's working. We know that we still have a lot of work to do in our community, even with our on-site counseling services. Melissa had pulled up the data earlier. 20-some% of our kids are feeling depressed, and 45% of our kids have anxiety. That's huge. That's almost half of our kids. So we have a lot more work to do, but this was a step in the right direction. We were so excited to share with you where we've been, where we are, and if people are interested in therapy,
Contact the Student Services Office at that school. It's different for each school. Sometimes it's the guidance department, sometimes it might be might be a social worker or assistant principal even. So just call the school and say, I'm interested in this for a child, and they'll be able to get you to the right place that can get that set up. One thing that we want to stress is how important it is to talk to your kids that you are the parents for, or maybe the youth that you work in. Like, ask them how their day is. How are things going? I can think about a panel that I did with Kayla and Ethan, and someone had asked, well, what are the warning signs of depression and anxiety? I'm like, well, it's kind of hard, because it's like when you list the typical signs, it's being reclusive, being in the room, and like a lot of adolescents, that's what adolescence is. So what I've come to believe is instead of looking for warning signs, have the conversation. Try to have contact with that child every week and just check in with them in terms of how is life going? What's happening? What do you need some help with? How are you feeling? How is your anxiety level? And if they do that on a regular basis, the first time they might be like, I can't believe you asked me that. But the more often you do that, the more they get used to that, and they'll talk to you about it, and they'll open up to you. And then you can get them the help that they need when you can see that it's rising to the level of needing therapy.
Well, thank you guys so much. We want to end it with any questions too, or comments, or anything that you guys have about school-based counseling services.
And I do want to point out the 2017-2018, the first report from the first year is uploaded. It will be in the calendar, so you can look at their first report, and there's a lot of great quotes in that report as well.
Yeah, so what's up here is our impact report. It talks a little bit about what counseling is. It has a lot of the data that we collected from the students that are in therapy. And then it also has some of those warning signs and some things you can do as a parent or a guardian or a community member. Another one will be debuting fall of 2020 with newly updated data.
Thank you, guys.
Thank you.
So now we've kind of talked a little about community, we've talked some about school-based initiatives, and now we're going to get into our youth-serving organizations who work in both. Kim.
Thanks. My name is Kim Larson. I'm the Chief Operating Officer at the Boys and Girls Club here in town. I've been with the club for about 18 years, and in that time we've seen a significant transition in the kids that we're serving. When I started at the club, we were serving a lot of older kids. Skateboarding and rollerblading were hugely competitive in our community. It's hard to believe it's been that long. At the time I started, we had 2 sites. We now have 3 sites in our community. We are at the Kayla S. Mark site on North 2nd Street. We have our DC Everest Middle School site and our Green Hack Fieldhouse site. On an annual basis, we serve about 1,900 registered members through community outreach initiatives and opportunities through whether it's United Way or different partner agencies. We serve about 5,000 additional kids in our community. Community Fest is a huge part of that as well. But throughout the club, our average age is about 13 years old on any given month. Traditionally, Boys and Girls Clubs serve grade ages 6 through 18, and most clubs nationally really focus on younger kids. In our community, we were designed as a teen center. We remain a teen center. So we provide services to 4th through 12th grade. In Wausau, we provide busing from 11 different schools to get kids to the club. We serve after-school snack and dinner. During the summer, it's breakfast, lunch, and we added after-school snack. At our Green Hack Fieldhouse site, it's 8th through 12th grade, and you may be surprised to know that on any given day, there are about 90 kids that visit that site. Our DC Everest Middle School serves those 6th and 7th graders. We started there 11 years ago, and we serve about 70 to 90 kids a day. So on an annual basis, or a daily basis, between 300 and 350 kids are walking through the doors of a Boys and Girls Club. When they get to the club, they are finding caring, trained professional staff, a significant number of volunteers, and opportunities for them to participate in programming to develop good character and leadership, ensure academic success, and adopt and practice a healthy lifestyle. Our goal is to really reinforce what kids are learning in schools through the academic success portion. We do not try to duplicate what they're learning in school. We just want to reinforce those good practices and make sure that they are getting their homework done, that they have the space to do it. If we are not the people to do it, that we reach out to partners, whether it's calling the school or finding volunteers to do that. Our job is to make sure that when they are graduating on time from high school, that they are prepared for life after high school. Most of our kids are club members for at least 3 years. So once they start, say they start in 6th grade, we see them through their 9th, 10th, 11th, 12th grade. Our club members make our best employees also because they know all the ins and outs of the club. Boys and Girls Clubs really focus on intentional small group programming, so whether that's partnering with the Girl Scouts for Girls with a Purpose, Guys Only, Torch Club, and Keystone are our middle school and high school leadership groups. The idea is to really give kids a space for them to come and be themselves. We heard a lot about kids not feeling that anxiety, that pressure. Whether it's one-on-one conversations with our staff or those small group opportunities, kids can really come to the club and find their own space. A lot of kids that we talk to will say that once they walk through the door of the club, they found their second home, or they really felt like they could be themselves. 93% of our kids in our most recent survey say the club helps them feel proud of themselves. 96% have a staff member or volunteer that they can talk to. So kind of echoing some of the statistics that you saw. When kids come to the club, they come for a variety of reasons. They are coming because their parents are at work and they need someplace to hang out until they are getting picked up from work. There's no one home. They are responsible for a younger sibling, and the younger sibling can come, so the club becomes the fun place to go. There are homes that they don't want to go to, and there are just a variety of reasons. That free transportation every day after school from 11 Wausau schools, excuse me, and being on site at the DC Everest Middle School and the Green Hack Fieldhouse is really attractive to families. It's really gives them that opportunity to know, especially at the DC Everest Middle School, being out in the middle of nowhere. If school is done at 2:30 and parents work until 5, they're not getting there until 5:30 or so. So that site is open until 6:30. During the summer, we try to be available when parents are working, so we are open 6:45 a.m. to 5:30 p.m. For 11 weeks. And the goal during our summer program is to make sure that we provide a summer experience that kids can't find anywhere else. For a lot of kids, the Boys and Girls Club is their summer. So as you think about planning your summer vacations, or if you are a school district employee and you get the summer off, our kids don't have that luxury. They don't have that opportunity. So when we think about planning those fun field trips and getting kids out of town, whether it's going to the pool 5 days a week or Marketplace Thursdays, which I know is no longer, or whether it's going to Green Bay, for some kids that really is their whole experience. We have kids that we will see every spring break from the time they are in 4th grade until the time they are a junior in high school and they have a job. So for those of you that are planning those beach vacations, just kind of keep that in perspective that a lot of kids in our community, and 60% of our kids, receive free and reduced lunches. So at the club, we also provide one-on-one mentoring with our staff and volunteers. So we have a federal grant to provide that opportunity for kind of a case managed, separate than what Big Brothers Big Sisters does. They stop matching at 14 years old, correct? So a lot of our kids are teens that are paired with a staff member, and it's just that check-in point. There was a kid in my office yesterday who was talking to me about trying to become emancipated from her family. So it's the opportunity for them to really have those conversations that they can't necessarily have outside of the confines of our walls. Or it's the opportunity for us to say, this is far beyond my scope of knowledge, and I'm going to reach out to whether it's school or counselors or social services and get other folks involved. Our Career Launch initiative is designed to make sure that kids have not only a plan, a goal for life after high school, but the steps and plan to achieve those goals. So whether it's supporting the school's ACP work and making sure that kids do graduate on time, or as they are getting into their junior and senior year, that they have that additional resource so they can reach out and call somebody that they know. We had a kid that went off to college. He was the first in his family to go to college. We asked him in August if he was ready. He's like, yep, I have my backpack. He had nothing else. Didn't know he needed sheets and laundry detergent and all that stuff. And so by working with him, we realized that we need a little bit more reinforcement, a little bit extra support. We decided to expand that mentoring component into their sophomore year of college because he dropped out in November of his sophomore year and never picked up the phone to call us. Never asked for help. He was too embarrassed. He was too depressed. He was anxious. He had all of those warning signs that we saw on that on the risk assessment. He just didn't know where to turn. After multiple reaches and multiple asks, he still has yet to step foot back into our building, unfortunately. So we're working on it. But our high school leadership group is also helping to reinforce some of what's going on in the community. Our kids are in 8th through 12th grade at our Kayla McCauley site, and they have decided to take mental health and wellness of our organization as a whole as one of their projects. So they're actually leading the initiative in designing a staff wellness day to help bring club members in to support that effort. So not just to sit down and talk at other club members about that, but to bring them into the fold and planning that opportunity so that our staff can see from our kids' perspective, what they need for support, and then they can mirror some of that into their programming. Looking ahead, kind of where we are focused is making sure that we are reinforcing what everybody in the community is doing, whether that's reaching out to additional community partners and bringing folks into the club to support our kids, expanding our partnerships with the schools. We are rolling out a brand new membership application, which includes everything from safe passages to and from the club, so parents are allowing kids to leave with their permission, or ensuring that we can reach out through the schools and share information that we have, whether those kids have an IEP or they have a counselor, or that we can pick up the phone and call those teachers when someone might be struggling or telling us that they don't have homework, which is not necessarily true. And expanding those volunteer opportunities too. So our doors are always open for volunteers, whether you know how to knit or crochet or you know mixed martial arts like at Rising Sun. But our key really comes back to our staff. So we can serve 1,900 kids, but if we don't have the staff and volunteers to support that effort, it's really just a building with kids. So our staff professional development days started this year, and through 6 a year, we're focused on everything from trauma-informed care and meeting our kids where they are, understanding the impact of human trafficking in our community, drugs, poverty, anything that touches the lives of our kids, we are trying to bring into our staff professional development days. Working on bringing community resources in for everything from love and logic to our staff having input and voice in how we serve our kids. Looking at our spaces, including our Carolyn S. Marks site, and understanding that you can't have the same conversation with a 10th grader that you can have with a 4th grader or the other way around. So figuring out what our space looks like and differentiating those program spaces so kids they continue to have that space, and as they age with the club, they can continue to have their own defined spaces. Any questions about the Boys and Girls Club? Thank you very much.
Excuse me. So Kim's going to give me some information, and like I said, everything that we're sharing today will be uploaded to the website. We have Girl Scouts up next. Of course, I didn't pull up the presentation. So you can either stand here and click, or you can click, whatever works for you.
All right, sounds
Can I
good.
just leave it for you? No clapping. We haven't advanced to that point yet.
All right, hello everyone. My name is Andrea Hodak. I'm with the Girl Scouts. I'm a reaching out specialist. I've been involved with the AOD Partnership for a few years. Normally Rochelle Alger comes here, but unfortunately she's on medical leave, so you get stuck with us.
Sorry. Wah, wah. And my name's Gwen Taylor. I'm the Program and Inclusion Director. I've been with the council for 13 years, and I'm excited to be here with you. We're going to talk a little bit about the generals of Girl Scouting, just to give everybody a base, and then how we feel like we're connected to the work that brings you all here today.
Yep. So who's familiar with Girl Scouts at all? Whether someone's been a leader,
Cookies don't count.
Cookies
Like in addition to the cookies.
So a lot of people are familiar with Girl Scouts, but we actually, Girl Scouts entails a lot. And we have our Girl Scout mission here, which has been tweaked over the years, but it's been the same mission for about 100 plus years. So it's Girl Scouting builds girls of courage, confidence, and character who make the world a better place. So a little bit about our history and geography. Excuse me. I have a little cold, so don't mind me. It's one of the oldest youth-serving organizations in the United States. It was founded by Julia Gordon Low in 1912, and there's currently 112 Girl Scout councils throughout the United States. Right now, we serve about 15,000 girls throughout our councils, and there's 5,000 adult volunteers. Our region is the central region here, and everything in color are all of our regions, all of our centers. And we have the Appleton, Green Bay, Schofield, and Eau Claire one, and Michigan. And we also have 7 camp locations throughout Wisconsin and Michigan.
Oh, this is me. So I want to talk just a little bit about Girl Scout programming. I think you're all familiar with the cookies, right? So we saw that. I put them out on the tables to bribe you because we prepared very last minute. So for any errors, just eat a cookie and you'll still like us. But I really want to talk about what are we actually doing. And so what you can see up on your screen is a little bit about how we do what we do. So in the pink on that side here, you'll see that everything that we do in Girl Scouting, whether it's through a patch or through a journey or a community service project, is about discovering, connecting, and taking action. So whether that's discovering something about yourself and then connecting to your peers and then doing something to make a difference, or rather that's discovering something that you're passionate about, connecting that globally, and then creating community service projects to support that. But that's the kind of the basics. Everything that we do is girl-led, learning by doing, and cooperative learning. So we have all the different types of learning styles that we're using, and we add in girl-led whenever we can, because it's each their own journey. In the center, you see our short-term outcomes, which I'll talk a little bit about soon, like probably the next slide, very soon. And then at the bottom is our mission again, which is also our long-term outcome, what we're working towards. I'm just going to clap because she's going to move it for me, so it works for me. So what you see here is our 4 program pillars. Everything that we do fits into one of these pillars. Entrepreneurship, so yes, that is the Cookie program. It's the world's largest female entrepreneurship program. We put thousands and thousands of girls through this. They look cute, they show up, you want to buy cookies, but it's so much more than that. There are 5 skills that every girl is learning through the Cookie program: goal setting and marketing and all of these other things that are a part of the Cookie program. So when you see that little girl outside of Pick and Save, ask them, like, what are you working towards? What are you trying to accomplish? What are you learning? All of those things. Then outdoors, of course, for the Girl Scouts. So outdoors is a huge part of it, whether that's badges or camp or whatnot. Life skills, like everything that could fit in that bucket, right? And then STEM. STEM is not new for us, but it is a new focus just because we are all about breaking down barriers, and we want to make sure that we have as many women represented in STEM field as men. So that's why that's one of our focus areas. I really like that. So here are outcomes with some more description. Sense of self, what that means. Girls have confidence in themselves and their abilities to form positive identities. Positive values, so that looks like girls acting ethically, honestly, and responsibly and showing concern for others. Challenge-seeking, girls take appropriate risk by trying things, even if they might fail or make mistakes, which we're not really good at as a society, by the way. We teach girls that, like, you raise your hand only when you're 110% sure that you know the answer, and that we don't, don't jump off of that, don't do that. It's a different society for girls, and so we really want to teach healthy risk-taking. Healthy relationships is huge, obviously, like still working on these things. I love reading this one because we are in the Midwest, and so I think like most adults are going, oh yeah, I could do that too. So we work on developing healthy relationships by communicating feelings directly and resolving conflict constructively. So I know that that's hard for a lot of us, but something that we all are working on together as Girl Scouts, and then community problem solving. So I talked a little bit about that already. So now Andrew's going to talk a little bit about what Girl Scouts do, because it's actually quite diverse. There's so many different opportunities to be involved in Girl Scouting.
Yeah, so like Gwen mentioned, there's plenty of ways that girls can be involved in Girl Scouting. We have our traditional troops, where it's usually the same group of girls that meets about twice a month, and they do a variety of activities. Girls can join as an individual Girl Scout member, where they still can participate in things like camp or other events, but they might not have time to go to those traditional troop meetings. So it's basically like they're online doing their troop meetings. We also, girls can participate in Girl Scouts by going to a camp. We have resident camps, day camps, camps that are 2 weeks where they're going on trips. It's really awesome, the camps that we provide.
I'm actually going to interject too, because something that Kim said really resonated with me. Like, the girls we're seeing at camp today is completely different than 13 years ago when I started. So the things that we're dealing with at camp are just night and day differences. All of our camp staff get 8 hours of trauma-informed care training by me, as well as diversity and inclusion training, because it is a daily basis that we're, girls are divulging information to us of abuse and neglect and self-harm and suicidal ideation, or even suicidal plans on a almost daily basis at our camps. And so making sure that we are equipped to ever keep changing with the girls and be able to meet their needs is really important, and something that we're working hard at. We're excited. We opened camp on Wednesday last week, and we already have over 700 girls registered for camp, which is super exciting. But we're just also really aware of what we need to do to continue to provide good support for those girls in that venue.
Yep, and then we have a reaching out program, which that's my specialty. I'll talk a little bit more about that in a minute. And then we also have our highest awards. So we have the bronze, silver, and gold. Bronze is 4th and 5th grade, silver is middle school, and then the gold is for the high schoolers.
So the thing that you'll hear about all of Girl Scout programming is very progressive. A lot of people, I think, have an idea that Girl Scouting is for your elementary age girls, which it absolutely is, and that is our biggest base, but really we have things for girls through high school. And this is just a little bit of it. So the gold award, you know, when you start the bronze award, that's 4th and 5th graders in a whole group, and they're like, what do we care about? And they do something like a really cool service project for the Humane Society. But as you work up, to get your gold award, you have to put in more than 80 hours into a project. You have to fund it by yourself. You have to figure out how to make it sustainable. You have to figure out how you're identifying a root cause. You have to get all of your volunteers by yourself. It's very progressive. Everything we do, and you know, daisies, travel is another pathway. So daisies might be going to their local animal shelter, because I just used that, so it's easy to use again. And brownies might be going to the next city over, and once you get into middle school, you're going to Washington, D.C. or Georgia, and when you get into high school, you're often taking trips all alone. My oldest daughter took a trip, which is called a destination, between her junior and senior year in high school, where it was nerve-wracking for me. I think I grew too. I put her on a plane. She called me when she arrived in Costa Rica from some kind of box phone, and then I didn't hear from her for 10 days. There was no technology while she was out in the rainforest. She did a release of leatherback sea turtles into the ocean. She did autopsies on the leatherbacks that didn't hatch. And then she also did community service for several days with an indigenous population called the Bree people, where she slept with scorpions. So it really does progress, and there's something for everyone. And so I just like to point that out, because it's something that not a lot of us really know about.
All right, so we'll get more into our programs for reaching out. So our 3 main programs are Shine, Community Connect, and New Visions. And in these programs, we're serving about 1,500 girls per year, and about 900 in Marathon County alone.
1,500 in the central region,
Yeah.
more than 4,000 throughout our 58 counties.
Right.
52 counties?
58.
58. Should have gone with the gut. You had it right.
So Shine is where we collaborate with schools, and we're providing program either before school or during girls' lunchtime recess. And we do a bunch of activities, songs, games, but in doing this, we're teaching them a variety of topics. And then Community Connect is where we collaborate with partners like Boys and Girls Clubs, the YMCA, several other organizations we partner with. And those are typically for 5 through 17-year-olds, and there's summer times we're usually with the younger kids, During the school year, it's mainly at the Boys and Girls Club, working with teens, tweens. And then we have our New Visions program, and that's where we're at the Marathon County Juvenile Detention Center, and we go out to Copper Lake. And we do programs with those girls.
If you're not familiar, Copper Lake is our state detention facility in Irma, Wisconsin. Really close to camp. Coincidentally, we've been able to take them to camp sometimes. So.
Yeah, so with these programs, like I said, we go to the sites. So we're breaking down the barriers that some girls might deal with, whether it's transportation, whether it's basically they can't go to those meetings every single couple weeks or something like that. So it could be cultural language, it could be financially, they can't make it there. So we bring our supplies to them, it's no cost to the kids, and we provide these programs. So we do, like I said, an array of curriculum that we teach, and you guys should all have an example. You may have grabbed it over there, and it's my emotions wheel curriculum. So with this one, we're talking about social emotional learning. We also do topics like diversity and inclusion, STEM, health relationships, community service.
So the curriculum example that you guys have is just one of many. We have several, again, social and emotional learning. But to somebody looking into a room is just going to see a bunch of girls laughing, having fun, doing songs, and so on and so forth. But what they're actually taking away is being able to identify their emotions and what they might need when they're experiencing those emotions, because those aren't things that we're always taught. So we're making sure that we're talking about these things regularly. And of course, that looks different from a second grader to a girl at a detention center. We talk about these a little different, I promise. But it's important and it's there. And so the reason that we printed an example is just so that you can see that we're really intentional about everything that we do in Girl Scouting. Not everybody's aware of that. So you can see right at the top, we're training all of our delivery staff in what are your outcomes, what are your indicators, what are you working towards, what are the talking points. And then you also have a handout that is an outcomes map. So it's just telling you what are we measuring, what are our indicators for both girls and our sites, and what are we asking and what are we striving towards, just so you can see those aims again and how they equate to those 5 outcomes that I was talking about earlier.
Yep. So our next slide is about the outcomes, and Gwen can talk about that a little bit more.
So this is just fun to revisit. So we just talked about this, so I'm not going to go through each one, but I really want you to think about them for a second and like what that means to you and what that means for the girls that you serve in your practice or at your site or that you have in your home, and why these outcomes are so important and how they might connect to AODA stuff as well and mental health stuff.
All right.
So what do these outcomes look like? I honestly, if I had time, I could share like 15 different charts and graphs with you that are really surprising. But we have a Girl Scout Research Institute, and we collect a lot of data from our alumni as well as our present girls through Qualtrics, which is a outcomes-based survey process and warehouse. And these are some of the things that we see, that Girl Scouts are happier, healthier, and less likely to engage in problem behaviors and be victimized. Girl Scouts achieve more academically and are more engaged in school. Girl Scouts become candidates that employers like to hire, and Girl Scouts become successful, well-adjusted adults. So typically, if we were looking at other charts, you're going to see Girl Scouts versus non-Girl Scouts, and you're just going to see all of these things kind of coming to the surface. And what this means for our communities is that we have greater female representation in the top levels of businesses and governments and institutions, which is obviously a goal, why STEM is becoming a focus area for us. Again, not new, just a focus area. Achievement of a higher level of success and boundary breaking. Been doing it for 100+ years, and we plan to do it for 100+ more. So I wanted to talk, and this is interactive, just so you know, about like what is that connection? And so sense of belonging. You know, we hear a lot of things about how important it is. You know, an antidote to addiction, if you will, is connectedness and a sense of belonging. Girl Scouting offers a sense of belonging, whether you're a part of a troop or you're at camp. I swear to goodness, people become best friends for a lifelong on day 2 of a campfire. I don't know how it happens, it's magical. Like I said before, we take a trauma-informed care approach. I'm a trauma-informed care trainer, and we offer it to all of our staff. All of our camp staff and all of our reaching out staff are required to take trauma-informed care. We build resiliency through trying new and difficult things. So whether that's getting in a kayak for your very first time and you're freaked out of water, believe me, you wouldn't believe the things that I've been yelled at for putting putting a girl in the kayak, like, I can't believe you're doing this to me, Miss Gwen. You're fine. And what that feels like when she actually gets back and she's paddling or jumping off something to rappel for the first time, or simply leading a song for the first time. That could be overwhelming for many people. The opportunity to take healthy risks. So this is really important. So what we know is that our bodies crave connectedness, and we crave these hormone releases, right? We need that, and we're going to get it somewhere. So what we would love in Girl Scouting is for them to get that in a healthy space, in a healthy way, that they're connected to healthy peers and to positive mentors and adult role models, and that they're getting that thrill and that chemical release, those endorphins that they need through healthy things like ziplining. It's really fun. We offer a safe space, which is really, really important. It was brought up earlier, giving girls a place. We deal with a lot of things that come out in Girl Scout programming. You'd be surprised. So I talked about camp a little bit, but this is also happening in our reaching out programs and our troops on a regular basis. At least every week I'm working through, now we do cover 52 counties. But every week at least I'm working on a case with a girl who has divulged sexual abuse or is saying really inappropriate things that are indicating sexual abuse or self-harm on a absolute weekly basis. And regularly in our reaching out programs, we get feedback that people are, that girls are struggling. I mean, we've even had on an evaluation, which was a really weird place, a girl tell us that she was thinking about suicide. There wasn't a question there. We weren't doing a screening, it was just a program evaluation, but they feel safe to open up to us. And the detention centers, you wouldn't believe the things that we hear because it's just a safe space for them to share. An opportunity to make new friends, again, that connectedness, and then access to programming that teaches healthy habits, coping skills, interpersonal skills, social skills, so on and so forth. And then I wanted your guys' thoughts too. So as we're just talking through this, what do you see as a connection to the work that we're doing and why we're all here together? Because I'm sure there's stuff that I missed. Again, we did it in a hurry. Anything that pops out? We're all going to be quiet? Stick another cookie in your mouth? It's fine? No? Okay, any questions for us? Nope?
We'll have a little time after too.
Yeah, thanks for having us. Thank you.
All right. Good afternoon, everyone. I'm Beth Conard. I'm the program director for Big Brothers Big Sisters in North Central Wisconsin. I'm excited to be here to talk not only about our program, but really how we tie in with our AOD connection as well. Oops. No, you're fine. You're good.
You can use that, or you can use that. I'm gonna get out of here.
Okay, perfect.
Mess it all up.
So I wanted to kind of bring this to your attention. How many of you guys are familiar with Big Brothers Big Sisters? Oh, awesome, a vast majority of you. But I think it's important to kind of talk a little bit because in 2019, from our national office down in Tampa, Florida, all the way to even North Central Wisconsin, ooh, it's jumping ahead. Oh my goodness. All right, that's all right. We did a rebranding. So one of the several things that we rebranded is our mission and vision statements. So our new mission says that we are here to create and support one-to-one mentoring relationships that ignite the power and promise of youth. So many of you are probably very familiar with our old logo that had like the swoopy characters and that kind of thing. And in the 7.5 years I've been here, we've had different taglines like start something big, little moments, big magic. And now we are considered defenders of potential. One of the big reasons for that defenders of potential is because we believe that all kids have potential. But for a lot of kids, they need that empowerment to receive that highest potential. They need those people that empower that potential and give them that confidence to show them that their value is not only within themselves, but within their community. So if you notice, we went from the swoopy characters holding hands to the power of the B. And that's kind of important to us because, I mean, most of our name starts with a B. But if you notice, it's in two different colors. So the lower part, the white part in the lowercase b, represents the child and the parent and then us. And it's bringing those three pieces together and you form a powerful part already in the lowercase b. That doesn't tell the whole story. To get that whole story, you need to add in that green part, and that's where our volunteers come in. In 2019, we are very proud to report that we had 348 individual one-on-one matches that took place here in Marathon County and in our Merrill community. We are very excited that we got to serve 7 school districts, 2 of which are brand new in the last year and a half. So we work very closely with the school districts, including Athens, Abbotsford, DC Everest, Marathon, Mosinee, Merrill, and Wausau. I got them all. Typically I have to do them in alphabetical order. All right, I don't know why this keeps going. That's unfortunate, but that's all right. So all of the kids that we serve are between the ages of 6 up to 14. We do still continue to serve children even after they turn 14 if they are in those long-term support systems, which is ultimately our goal. Internally, we want the longest, strongest matches possible for our kids. All the kids that we serve are referred by either their teacher, their guidance counselor, or their parent for a variety of reasons. So that can be social, emotional, educational, or behavioral. And I will say, and I'll kind of echo this trend that a lot of others have said today, what they were getting initially referred to 7.5 years ago when I started is vastly different than today. Unfortunately, we really see it as kids have a lot higher needs. You know, beforehand it was a lot of, well, they were just struggling to kind of make friends and things. And yeah, that might still be the case, but there can be a lot of underlying factors in that as well. Although that they're referred to our program, one of the unique things about Big Brothers Big Sisters is that when we go and talk to that child about that referral, they have to tell us that they want to be in the program. This is not ever something that they can be court ordered to do, or even as strongly as their parents saying, we really have to have this for them. We want to make sure they're invested into this because we want to give those kids the autonomy to choose. So often kids aren't given their own voice, and we believe that that's a problem. We really want to make sure that they feel heard as well. So, like I said, kids come from a variety of backgrounds. Unfortunately, in the last few years with our opioid epidemic, we definitely do see that the incarceration rate of our parents have increased. So just a few years ago, we hovered right around 7-8%. It has now jumped to typically, on average, around 11%. It has at highest been up to 14%, unfortunately. So it kind of, varies, and we definitely do see that not only is it sometimes one parent, a lot of times now it's starting to be both parents as well. 72% of the kids that we serve are free and reduced lunch. And I say that only because we talk about things of opportunities. For a lot of our kids, when they are in a lower income status, maybe they don't have those opportunities to have all of those board games at home. And it's amazing to me, I used to be an enrollment and match support specialist, and when we go and check in with the kids, we're asking what activities they do. And I see the smiles on those faces when they say, I played Sorry for the first time. How many of you in here today either have Sorry in your house or had it when your kids were young? All right, almost all of you. But for our kids, that's something so new to them that it's just a huge opportunity. About 52% of the kids that we serve are living in single-parent homes. Again, when we start talking about connectivity, when you're living only in a single-parent home, that mom or dad is playing the role of both parents. They're getting up and having to go to work every day. They're trying to manage a household. They're making sure that child is where they need to be and taking part in what they are capable of or having those opportunities to take part in. That's exhausting. And at the end of the day, they may not have the energy to sit down and play Sorry if that's what's in their house. Maybe sometimes just getting to that point of doing the spelling words and things is all that they have time for. So having those really big opportunities to connect those children with other resources is a huge deal. We've also noticed an increase that up to about 6% are living in a different placement, whether that be with an aunt or uncle, with a grandparent, in foster care, or in a group home. So it's a lot of variety of what these kids are coming from. So when we kind of tie this into our AOD, we have 2 different mentoring options that a child can take part in. So I mentioned the 7 school districts that we work with. So we have a very heavy school-based program that allows a lot of times our high schoolers, but also our adults, to go in and meet with a child in either the elementary or middle school and hang out for roughly about half an hour to 45 minutes, doing things like playing games, helping with homework, maybe having lunch together, those types of things. And we also have our community-based mentoring. So that would allow an adult mentor to actually go and take them and do things like play at a park, go to a library, go hike Grid Mountain. So many different options that they can do. So when you think about that, all 348 of our matches that we served last year connected a child with at least one positive adult. That's that person that they feel like they can turn to, because what we've seen and what we've heard today is that a lot of times kids don't necessarily feel like they can talk to their parents about what they're feeling and what things that they're going through. But this is someone, an outside source, that, you know, they can kind of bounce things off with and tell their feelings to, and they may not feel like it's going to be as judged as when they talk to their parents. I think the other important thing to note is that we're not only connecting them with a mentor, we're connecting them with our staff. So all 348 of those kids that we served last year got to talk to one of those 4 people sitting in the back of the room. It's their job every day to go and talk to those kids and check on things like safety and making sure they're enjoying their match and checking in on how school's going or how things at home are going. And that's a powerful thing when it's that same person month after month coming in and checking with them. So I always say that, you know, we have that positive adult and their mentor, but we're actually putting more than that within them because it's somebody else that's coming to check on them. Promoting that good self-esteem. You know, for a lot of our kids, they don't have a whole lot of self-confidence. And it's working up to making those friendships and things. I'm sorry, this is getting so annoying. I wish I could somehow pause it. This is why I don't use technology. We'll just own that right now. You know, it's giving them those good decision-making skills and really kind of having those consistent routines. So in our school-based program, we really set it up. It's the same day and time every single week. So not only does it become part of our volunteers' calendars, it's something that our littles look forward to. And it's so funny to hear. We'll get emails at the end of the year from a teacher and be like, yeah, Susie was waiting in the classroom 5 minutes before 3 o'clock to make sure that Lily was coming to see her today. It's something that they come to depend on. And having that routine is such a strong protective factor. As I said, our 4 amazing enrollment and match sports specialists are going in every single month and talking to those kids and monitoring their activities. Not only activities with their volunteers, but activities that they're taking part in their school environment, in their home environment, their extracurriculars, and really seeing what areas that they're really enjoying, but what areas that we can get them connected to as well. So especially in our community-based program, we have those parental and family supports as well. So our enrollment and match sports specialists are not only talking to those littles and volunteers every month, like in our school base, but we're talking to our parents as well. We're figuring out what resources that we can provide and really being there as a sounding tool. I continue to have 4 matches on my caseload, and all of them have been matched for 4 or more years. Some of them have been there the entire 7 years that I've been there, and it's amazing. There's stuff I know about those people more than I know about my own siblings. So that should tell you how much I talk to them. We're also really monitoring school attendance. It is amazing as we do surveys at the end of the year of when we talk to our teachers and things that they will say they look so forward to their big coming on that specific day that it increased their attendance rate because they wanted to be there. They took an active part in school. So for our outcomes, you know, because every nonprofit is outcome driven. So at the end of every year, we check in with our teachers and really say, what can you tell us? What impact have we had on the kids that we're serving? And we've really seen that 99% of the children that we see either maintained or improved their level of self-confidence. That's huge. Realizing that they are confident enough to go out and try and make those friendships, taking those healthy actions to maybe take those risks that you guys were talking about. 96% improved or maintained their level of competence. So really when you think about that, not only decision-making skills, but academic achievements, and really looking at what they're now capable of before having a mentor. And then 97% maintained or improved their level of caring. So that's not only caring in their peer relationships and in their family relationships, but that's also in their level of caring for themselves and really realizing that they have a ton of self-worth and they hold value in their relationships, not only at school and with their family, but also in the realms of Big Brothers, Big Sisters, because it is amazing, and I wish we could figure out how to have an outcome of this. And we try and do this like there are match sport questions and stuff, but we're impacting not only that little, but we're having a huge impact on those volunteers that are serving those kids. Because it's amazing what our kiddos are teaching our volunteers. Or, you know, I had a high school student tell me just last week of, you know what, I get to go and just hang out and remember what it's like to be a kid. That the stress of studying and work just kind of falls away, and it's like my 30 minutes of I just get to smile. That's a powerful thing. And so we're always looking for more volunteers. Right now we have about 108 kiddos sitting on our waiting list. You know, we wish that we would never have a waiting list, but unfortunately we know that as soon as one comes off, 2 more pop on. So I know that was really brief, but I wanted to make sure that we had enough time for our last speaker as well. So any questions?
Awesome, thank you. Can I just have you come up to the front here? Please. Thank you, everybody. So far, we got one more speaker. We've got Bernie Corsten. I said that right?
Yes.
Yes. From NAMI. She's going to talk about one of the programs that they've been working to try to get into some of the different schools. I have your logo up. Did you want the website up, or are you good with just that? 'Cause I can pull the website up if you want. Sure.
Okay.
You can introduce yourself though first.
I'm Bernie Corsten. I'm the president or director or whatever. I wear many hats with NAMI Northwoods. Probably some of you know of that. I actually was a big sister years ago, and I've always sort of connected with a lot of different people. And this is sort of this is our NAMI Northwoods. Has everybody heard of NAMI? We're a national affiliate, and we have a lot of different programs that we offer people in the community, and basically we do the family support and the family-to-family education piece right now, and we started with the peer-to-peer, which is education for those who are having mental health issues. So we're sort of excited about that, and we want that to grow. And we also have, through NAMI Wisconsin has a program for the schools, and it's called In Our Own Voice. I believe that's it.
Yes.
No, Raise Your Voice.
Raise your voice.
Raise Your Voice,
Yes.
right. I get a little
I
mixed
can
up
probably pull
with
it up.
In Your Own Voice or Raise Your Voice, or and that you could go to NAMI Wisconsin. This is a program that NAMI Wisconsin created because they felt there was a need to have a club kind of format within the schools. And it actually, if you go online, it gives you the whole template of how to have a program for within the school district or any. What happens is that it has to have supervision, and it has to be for students that are under 18, or it's geared towards having a counselor sort of give them advice as an advisory format, where we tried to sort of think that we could do this on our own, but because it needs a lot of school interaction, this is more ideal to be within a school setting. It could work in another organization as long as you had some advisor to the program. I think it's got you can gear it towards any types of projects as long as you're sort of having different people, young people who are interested in mental health and helping those that have a mental health issue sort of understand some of the symptoms and how to work together with young people. I had a situation where I know that this is very valuable. We had 3 young girls come to our office from a school that were really in need of seeing a counselor, could not see a counselor, wasn't scheduled to come in. All 3 girls had very serious issues that were caused by certain trauma that had happened to them. Now, we're not qualified as an organization to give, to help them, but I think there needs to be a different setting for more the teenage group who are facing a lot of different personal trauma with mental health. Personally, I know I have a granddaughter who is struggling, trying to cope in the world, and I think there's many teenagers who would benefit from having a group, some type of setting. We try to approach different schools, and the schools probably have too many challenges finding a counselor who could work directly, but I think it's very valuable that we reach out to our young teens who are exposed to who knows what. So,
do people need to be trained in this program?
This is sort of self-run. They can look at it and see what works for their school or organization. It doesn't have to follow any kind of curriculum. It's just based on how you can. It's hard to explain it unless you really delve into it. And the Merrill School district is going to do this in their school. So I know that they're probably they have more of an educational kind of person through their I can't remember.
UW Extension.
Right. Mm-hmm. So they're implementing this in their school, and I think it's something that would be valuable. So that's my little pitch.
Anybody have any questions?
I have a comment. Our council, our Girl Scout Council, actually partnered with NAMI, and we have a NAMI mental health patch program that many of our troops are doing, so that we're talking about this at a troop level on a regular basis.
Are you with which NAMI?
We actually it was national, but we worked closely with the Appleton chapter to create
great.
training for the adults as
Yeah,
well.
I did have an inquiry with Shawano Girl Scout it was 4-H. So this could work in that type of organization. Thank you.
Any questions? Okay.
And like I say, you could just go online and get the template, and then, you know, if you have any questions, you can contact me at NAMI Northwest.
All right, cool. Thanks, Bernie. Okay, so, wow, look at us. 5 minutes early. I'm going to take one more moment to shamelessly ask that if anybody has any topics for the AOD Partnership Meeting in May, the first Tuesday in May, make sure you include that on your evaluations. Fill those out, leave those here. There are more CEU forms were brought in. I think they're over there. So if you didn't get one, they should be over there. I saw Leslie come in, so I just didn't look to see where she set them down. I've got nothing else.
Sign up sheet to go around.
Oh, did the sign up sheet get around to everybody?
I didn't see it.
Oh no. Nuts. I think it's back by Paula. How dare she? It is important that we kind of get some sign-ups. So if you can, just please write your name down. If I don't have your email, include your email. Paula will put it out on the end down there. One thing I did forget to mention is that there are, you could get up, move around, and sign up. There are some resources that are going to be on the slideshow, including the prevention tools, what works, what doesn't, because we know what works in prevention. When it comes to substance use, there's some resources that will be uploaded around comorbidity, some information on the science of addiction. Always reach out to 211 for resources and information, and then SAMHSA is another great resource related to this. With that, thank you to our partners for being here today. Enjoy your 2 minutes of time. Take it to fill in your evaluations with notes. Thanks, everyone. Clap on. He's like, I want to clap. I want to